A new Utah law requires doctors to alert women seeking medical abortions that the procedure can be reversed. Critics disagree, but Lauren Ashburn talked to one doctor who says the reversals can save lives.
Joining us now is Dr. Lorna Cvetkovic with Tepeyac OB/GYN in Fairfax, Virginia. Thank you so much for joining us.
Nice to be here. Thank you.
We're talking about abortion reversal from a medical abortion where someone takes RU-486, right? How do you reverse that?
Okay. Well, since RU-486 is an anti-progesterone and it ties up the progesterone receptors which are supporting the pregnancy, if you give mifeprex, you cut out that support. So by giving extra doses of normal progesterone, natural progesterone, you overwhelm that effect and reverse it.
So Planned Parenthood has a video that's out that shows, all right, here's how you get the abortion. You take this pill and then you take this pill. Under reversing that, you have to do what?
Well, what usually happens is that the woman takes the first pill, the mifeprex, and then has a change of heart. And so we hope within 72 hours, before she takes the second dose, she calls and we start her on progesterone.
Now, there has been some research done on this by Dr. George Delgado. He is working on this. He's published studies in the Annals of Pharmacology. He reports that the overall general success rate, 50 to 55%, maybe 60 if you can get optimal conditions. So why are there critics who are saying this doesn't work?
It's really hard to understand that because, first of all, one of the criticisms is it is not FDA approved, so it's an off-label use. But in reality, a lot of the medical abortions that are done are not done according to the FDA protocol, and so they're actually using off-label use drugs anyway.
So if you're pregnant and you want to reverse this abortion pill that you have taken and you do this, there's a 1 in 2 chance roughly that it would happen. How much demand is there for this?
I think it just depends on how good the person is at getting access to things, how much she regrets, how far she goes to find out an option.
I guess what I'm asking is, because so far he has only done maybe 12 cases that he reported and there are a couple hundred that he's working on, how do these women find out about it, and where do they go?
Solely through the internet. Solely through the internet, and there's a 24-hour hotline that they call, which goes to a nurse, and then the nurse has a list of 230 or 50 doctors throughout the country who will talk to that patient and get them started on the treatment.
So the women who call in there are pretty desperate, you would say, to want that reversed.
And I think the other thing, you know, again, I don't know why there should be a criticism of this. We know that not all women are fully wanting the abortion. There are many who have regrets. There are many who are coerced by family or boyfriends or whatever, and so this gives them an option to make a second chance, have a second chance.
And that can be found at Tepeyac OB/GYN, your clinic. Thank you so much for joining us, Dr. Lorna Cvetkovic.
Thank you.